Okay, well, welcome everybody. This is Barb Conley. I'm a member of this recruit providers team. Um, Something about me, I'm a retired oncologist and I'm a member of the Benzie-Leelanau District Health Department Board of Health. And I'd like to invite everybody on this Lunch and Learn to please introduce yourself in the chat with your name and your organization. Thank you. And well, next slide. So a little bit about the Northwest Michigan Community Health Innovation Region, fondly known as Shire. This is a cross-sector collaborative aimed at improving community health by removing barriers to social determinants of health at the individual or family and at the community and systems level across 10 counties in Northwest Michigan. Behavioral health has been identified as a priority need within the Shire region, and it's because of that need that the Behavioral Health Initiative was launched in June of 2021. The Behavioral Health Initiative itself has 13 action teams that work on projects to meet one of two goals: to improve access to quality behavioral health services in the region, or to enhance overall well-being and resilience. Our action team hosting this Lunch and Learn today is working to recruit behavioral health providers to our area. One of our team's goals is to provide organizations across the region with information and resources that can help to incentivize providers to come and practice in Northwest Michigan. Paige Recker with the Michigan Center for Rural Health is a member of this action team, and she's here today to present on different loan repayment programs that organizations can participate in and that they can include in the benefits they offer to current and incoming providers, and how participating in such programs can help to recruit employees. Paige, I'm going to hand it over to you now.
Thank you, Barb. Let me share my screen here. Okay, can everyone see the slides? Okay. Just gonna move this.
So it looks like, Paige, we're seeing not your presenter view, but like your whole slide deck.
Oh, yep. Let me.
Okay.
Sorry, this Zoom bar was in the way here. Let me move that. There we go.
Perfect.
Okay, great. And I am just going to stop my video just because sometimes I'm out in the thumb and sometimes just the bandwidth can get a little wonky out here, but hopefully you'll be all set here. But as Barb said, I am Paige Recker. I am the Access to Care Manager for the Michigan Center for Rural Health, part of the Recruit Behavioral Health Providers Action Team here, and going to discuss loan repayment programs today for behavioral health professionals. I can click next. Here we go. Agenda today. So briefly talk about kind of our team's year ahead of what we're looking at for Lunch and Learns as well. Briefly talk about health professional shortage areas and how they relate to the programs we're going to discuss today. So the National Health Service Corps Loan Repayment Program and the Michigan State Loan Repayment Program. And then wrap up with benefits of why organizations should participate in loan repayment programs. So looking ahead in 2024, our team had a really great discussion, open kind of office hours discussion a few months ago, just talking about what are organizations looking for helpful when recruiting behavioral health providers. So some topics you can expect in 2024 is creating attractive job postings, utilizing your organization's website as a recruitment tool, and developing interview practices that demonstrate excitement for work and motivate interviewees to accept the positions, and also the loan repayment process for the employees. So this today is going to heavily be on the employer side of when kind of for the site application process for both the state and federal loan repayment programs. I will be discussing, some of the employee side, but we plan to have actually a few individuals who have gone through both the state loan repayment program and the federal loan repayment program in a separate webinar. So that will be exciting though to hear how they went through the process and any tips and tricks for employees who are looking at loan repayment. So I won't go over all these acronyms, but these is what I will be bringing up. These acronyms you'll see throughout the presentation. And if you're looking back at the slides at all in the future, or if you're on the recording here later on to kind of reference back. I'll try not to use so many acronyms because I know it can get confusing a lot, especially, but these are just the acronyms that are going to be popping up a lot in this presentation. And I will also, I forgot to mention, I will be pausing in the middle after I talk about the National Health Service Corps presentation for any questions. So Amy will be monitoring those, any questions you have in the chat, and then also we'll do a little Q&A at the end. So hopefully the total presentation here will be about 40 to 45 minutes, so we can leave about 15 to 20 minutes for any questions. So health professional shortage areas, or HPSAs. So I'd like to mention these because, of course, they're going to be involved in a lot of our loan repayment programs. So I just want to kind of give a brief history about them and kind of how they came about. In the US, due to, I think it was back in the 70s, noticed few health providers throughout certain areas in the US. So the federal government and state partners came together to create shortage designations, or these HPSAs. And they really helped to prioritize the available resources to the areas of high need. So there's 3 different types of HPSAs. So there's primary care, dental health, and mental health. So we'll be more focusing on that mental health HPSA, but they're also broken down too. So there can be a geographic HPSA, a population group HPSA, and also facility HPSAs as well. So aside from auto HPSAs and HPSAs for federal correctional facilities, and we'll talk about auto HPSAs will come up here in a few slides, the state primary care office, so Michigan's primary care office, submits all applications to designate HPSAs. So they will be really a great contact, and I do have a few of their contacts here in the slides too, with regards to the state and federal site application. But if you're interested, you know, as you're looking at maybe your organization's HPSAs or HPSAs in general, you know, it may be seeing why is the score the one it is for your organization or for your county. Definitely reaching out to them and working with them because they really have the more in-depth information. I'm just kind of giving a high-level overview here. But for apply for a new designation or update any current designation, you want to reach out to them because they're going to work with HRSA, the federal government, to kind of help designate that score. So HRSA will give the final designation, and HPSA scores are on a scale of 0 to 25 for medical or primary care and mental health, and then 0 to 26 for dental health as well. And obviously higher scores indicate a greater need of providers within that area. And here's a screenshot I provided to of the calculation of the mental health HPSA. So I won't go through all of it, but just kind of giving you, again, that broad overview of how a HPSA is calculated. But the primary care office and HRSA, they're the ones that determine, you know, what's a 7-point calculation versus a 1 point for population to provider ratio. So again, definitely reach out to them if you're interested more about HPSAs. But onto the National Health Service Corps, or NHSC loan repayment program. Everything I referenced today too, it can be found on the NHSC site. If you go under there to eligibility requirements, I'm referencing everything from the NHSC site reference guide. So everything after this presentation, highly recommend reading. They will put a new updated one in there as it gets closer to the application cycle opening, hopefully in May or June, early June is expected. But I think a lot of people sometimes don't go through it because it is about a 60-page document. But I'm telling you, it's only probably about 30 pages of content because a lot of it is appendices and definitions as well. So definitely read through it. There shouldn't be any major updates, but definitely read through it as you're applying to be an NHSC site. So first off, we're going to start off with eligible site types. So we have 2 columns there, as you can see. One is an auto-approved HPSA sites, and there's the other eligible sites column. So for auto-approved sites, these sites can actually submit a new site application anytime during the year, versus the other eligible sites, you can only submit a site application during the new site application cycle. So, and both have to recertify every 3 years, but that auto HPSA is nice if your organization does fall under there. You don't have to wait till the new site application cycle opening. So just a little FYI on that. But also you must be a nonprofit status for the NHSC program. And a question that's come up, who is eligible for these programs? So there are 3 different types of programs within the NHSC programs. So individuals, when they apply, they can only apply to one of these programs at a time, even if they're eligible for all 3. That's just HRSA's, requirement. But as you can see, there are a lot of behavioral professionals in here. So health service psychologists, clinical social workers, psychiatric nurses, marriage and family therapists, and licensed professional counselors. And then for the other 2, you see substance use disorder counselors are added. The award amounts are there too. They do go up, as you see, but also so does the service commitment for the SUD workforce and the rural community programs. So just a little high level overview of who you can hire with the NHSC, or who can participate in the NHSC program, I should say. All have to be at least a master's or PhD doctoral level. So unfortunately, bachelor's level wouldn't qualify for this. So as you're thinking of maybe becoming an NHSC site and applying for the application, you're going to need to have at least 2 active points of contact. Unless you're a solo private practice, then you can have 1. But points of contact must cover 3 roles: administrator, personnel verifier, and recruiter. So one point of contact can have multiple roles. So you have seen one person be the administrator and another person be the personnel verifier and recruiter. But some sites have actually more than 2 points of contact. I've seen up to 6 before. Just sometimes it's nice to cover those contacts, especially if someone might be taking a leave, or just, just different changes in the organization as well. But you must have at least minimum of 2 active points of contacts. And it is recommended by HRSA that a point of contact should not be a recipient or a participant of the NHSC loan repayment program. Obviously, solo private practices, they do kind of give a little bit, just because if that is the only person who's doing the administration side and also maybe the clinical side, then it is up to that person. But HRSA just looks at it as kind of a conflict of interest. So I'd recommend, even if you do have a solo private practice, maybe having an administrator who can kind of be that point of contact for that private practice. It doesn't mean your application will get denied or that, but they are going to look at that closely, because it is kind of a little just concerning of if there could be another administrator kind of type to handle this kind of administration side of the site application. But all points of contact must activate and maintain a Bureau of Health Workforce Portal account. So the account creation is a 2-step process. So making sure all your point of contacts confirm their email address associated with each account for the organization, or else that account is not going to be active. Even if that contact is like a backup role again, they still need to have an active email and activate their own account. So in case anything does happen, they're not clicked out, and also too that you have an active account for the organization. So this is a screenshot of what the BHW portal will look like if you log in. So you'll probably pick either the Auto HIPSA point of contact or an NHSC, Nurse Corps, or other site, a point of contact that's down at the bottom to get started. And the link I put down there below is the user guide of kind of walking you through the step-by-step process of how to create a new BHW portal. I'm not going to discuss it here, but that is a good user guide to walk you through step by step. And we're going to go through all the documents and policies and data needed for the NHSC site application. But there are certain organizations or sites that aren't required to either submit or report just because of their status. So definitely check to see if your organization needs to submit everything, but I would still recommend, even if you don't have to submit everything, to have everything on hand, because HRSA can do site visits either virtually or physically now that COVID is the pandemic is kind of past now, but they can also ask for policies or documents upon request too. But I'm going to go over all the documents kind of like as all other site types here that are required. So the signing fee schedule program, so this one is probably a pretty significant one here. It does have a lot of policies and documents that need to be submitted. So biggest requirement though for this, you must have a discount program in place for at least 6 months prior to the opening of the application cycle. So you basically have to have one in place now If you don't, there is always next year. I know people want to probably get started on their application cycle or the site application, but this is, very much needed. And they look at 6 months worth of data. So definitely, has to start, if it does open in early June, start kind of that December 1st of 2023 to cover all 6 months. But the sliding fee discount program must be based solely on income and family size, and then applicable to individuals and families with incomes at or below 200% of the most recent federal poverty guidelines, so 2024. And the program, this must include a policy, patient application, sliding fee schedule, and posted signage. So this will be all uploaded in your application. And if you don't have a sliding fee schedule discount or sliding fee scale discount started yet at your organization, I highly recommend looking at this from the National Rural Health Resource Center, even if you're not a critical access hospital or rural health clinic, because it just gives you good resources and how to start one. So definitely check that out if you are kind of lost of how to create and start one for your organization. And this is the 2023, so I don't have the most current 2024, but it should just have came out too. So making sure you have the most up-to-date federal poverty guidelines. And so I'm kind of this is part of the kind of the sliding fee schedule discount, but kind of this is also a very big component as well because it talks about the 6-month reporting period. These are your data tables. So my most significant requirement, fill everything out here. Even if you have to put a 0, you need to fill out everything or else they will deny your application. So making sure you're filling out that first part, you do have that 6-month reporting period. But for the first table, it's going to go over patient and patient visits by primary insurance type. So you're entering a number of patients. Again, even if it's 0, put a 0. And making sure you have a calculator handy because the percentages will auto-calculate with whatever number you put in, but just making sure it does add up to 100%. And with table 2, here we're looking at the charges, collections, and adjustments. So making sure for each payment source, you're putting in the full charges, the amount collected, and then adjustments will just be full charges minus amount collected. So A minus B equals C, and making sure, again, using a calculator that adds up all correctly. And then table 3 is patient applications for the sliding fee schedule. So how many applications were approved in that 6-month reporting period, how many were not approved, and then the total is just adding of rows 1 and 2. There we go. And then table 4 here. So this is just looking at FTEs, service site staffing. Again, if you don't have some of these, personnel, just put a 0. Again, they're just wanting to make sure, filling it out accurately, but don't leave anything blank. There we go. So back to the policy side here. So for the sliding fee discount program policy, these are written policies applied to all patients. So at minimum, your policy should include patient eligibility, which will include frequency of patient eligibility, reevaluation, income, and family size definition. It also should include documentation and verification requirements to determine patient eligibility. How does your site advertise the sliding fee discount program to the patient population? And an explanation of any nominal charges. And it should describe how its collection policies for any outstanding debt. You can attach the collection policy to your sliding fee schedule policy. Biggest thing, this does not have to be an extensive document. I think many individuals I've seen have like a 60-page document. That sometimes can get you in trouble more than having just a few page one. I know in the appendices, they have, I think, about a 4-page example. I didn't screenshot it here, but as long as it contains that required information, it does not have to be this 50-page document. Obviously, if your organization has one established, that's great, and it is longer. Just making sure you're going through and updating the policy regularly and making sure there's no jargon that might contradict what you're trying to put when talking about the sliding fee discount program. And then to the patient application. So again, this should just be limited to family size and income questions. This should not include any questions regarding the patient's, personal information, their social security numbers, citizenship status, housing status, or marital status. And further with the income question, you really can't ask about, credit checks, payment history, Medicaid denial letters, acid test, or net worth here. And this, again, is from the appendices of the site reference guide. So very simple 2-page, kind of want to make sure you're comparing that with your own patient application for your organization. And then the sliding fee schedule as a whole, you must provide a full discount, no charge for annual incomes at or below the 100% of the federal poverty guideline. Provide a nominal charge, which can either be a sliding fee or a schedule of discount to annual incomes above the 100% and at or below 200% of the federal poverty guideline. Should be a FPG there, sorry about that. But nominal charges must be a financial that does not reflect the service's true value and can't be a barrier for patients. But you yourself, your organization, have the discretion regarding on how you structure your sliding fee schedule. Again, can be sliding fee, can be a percentage discount. It's really up to you. But again, this is from the appendices. This is a great example of a sliding fee schedule and how to kind of create one. They use the 2023 federal poverty guidelines. And I would also say too, sometimes what I've seen organizations run into trouble or get denied their application is sometimes they keep going with the family size and they, maybe stop at 15 for the family size. There could be family sizes larger in Michigan than 15. So that's why you need to include for each additional person, add this amount. You can do more than the 8 that they have here, but at some point you do have to just put for each additional person, add this amount. Sometimes people just forget to omit that because I think sometimes we just think, well, there can't be family sizes that much larger and that are within our population or within our county or that, but there definitely can be. So just be conscious of that and making sure. I just think this is a really great example to use. And then postage signage. So you see that statement in bold there. You can take verbatim that statement and put it on a paper, and this should be in your common areas. And it should also be on your website and any social media platforms. So the statement says, no one will be denied access to services due to inability to pay. There is a discounted slided fee schedule based on family size and income. So this should be out in your common area, whether that's someone when they're going to a doctor's visit or in a hallway where many patients pass by. This is where it should be displayed. So you'll upload one picture of just the full signage and then one picture of the signage displayed in your common area. And then one document of screenshots of this verbiage, either put from your organization's website. So you should have it on your website. And if you do have any social media, your organization, it should be on the social media as well. So this is just an example. Again, the left picture is from the appendices of what the picture should look like, what the verbiage or signage could look like. And then this one I pulled from a hospital's financial assistance section. I blocked out their name, but this is a good example of how they utilize it on their website. Onto non-discrimination policy. So we made it through the sliding fee schedule. So this policy, again, can be just a one-pager, and it's going to say this verbiage here. So your organization must not discriminate in the provision of services based on an individual's inability to pay Medicare, Medicaid, or children's health insurance program coverage, and then race, color, sex, national origin, disability, religion, age, sexual orientation, or it should be gender identity. Sorry there with the typos. But here's a perfect example of the screenshot here, again, from the appendices, from the site reference guide that you can, again, copy. I think sometimes organizations are hesitant to copy from the site reference guide, but that's what it's for. It's showing examples. Obviously, make it your own. But sometimes then I think a lot of organizations want to use extra verbiage or that. So definitely utilizing it as your own too. And then the clinician recruitment and retention. So you must provide a plan that states the policies and processes that your organization uses to recruit and retain staff. So this plan is to focus on promoting clinician resiliency and reduce burnout. The number one thing that I've seen organizations also put, you cannot put that you are an NHSC site because you haven't been approved yet to be an NHSC site. You can, of course, say we offer loan repayment programs, but you cannot specifically say that you're an NHSC site yet because you're not. There's not, you haven't gotten that sticker of approval. Once you have, that you have been accepted as an NHSC site, you can definitely update your policy and put it on there. But for now, you cannot put that on there. That's just HRSA's rule. They're going to deny it because, again, you are not an NHSC site yet. And also I would try to, really think of processes, strategies that really are effective, especially if you don't really have a recruitment and retention policy yet, or maybe needs to be updated. You can't just put, we'll have pizza parties or, things along those lines. Of course, they're helpful for morale in that. But they do want meaningful strategies, recruitment processes here. They are actually, the HRSA, the primary care office are going in depth into these applications. So making sure you have really top-notch recruitment processes, strategies. And if they're not working, maybe this is the time to reevaluate too, and looking, okay, what should we do differently? So again, just kind of going through that plan and making sure it's up to date as well. So proof of comprehensive primary care. So your site must provide comprehensive primary care. It's going to be medical, dental, and or mental and behavioral health, which corresponds to its designated health professional shortage area. So here we're focusing on more the behavioral health side. So making sure you provide behavioral health services. With the exception of substance use disorder treatment facilities, if your site does not offer all those primary care services, you need to have acceptable documents that show, hey, if it's not here, do we have a connection with someone, with another organization that we do work with? For example, even, I know a lot of FQHCs, federally qualified health centers, kind of have all three: medical, dental, and mental or behavioral health, but some organizations don't. So sometimes with that behavioral health focus, we can sometimes think, well, it's, separate from going to see their primary care doctor, but maybe an individual is moved to a new place and, hey, do you know of a primary care doctor? Do you work with a hospital or clinic at all? So definitely having those signed memorandums of understanding or agreement, any signed contracts would be beneficial. And that's what you would upload for that proof of comprehensive primary care. If there's no formal referral agreements, the site must provide a dated and signed description of how it ensures patient access to those ancillary inpatient and specialty care as well. So then the behavioral health services checklist here. So this, I'm assuming, is going to be required for most of the organizations on here. If you do not have these core comprehensive behavioral health services, then you wouldn't have to fill this checklist out. But I'm assuming since most are on this call do, you would need to fill this out to be designated as a mental health HPSA. So with that saying, that core comprehensive services need to be on site. So this is screening and assessment, treatment plan, and care coordination. So this all needs to be on site at your organization. There are some non-core comprehensive behavioral services on site that can be either on site or off site. So these ones you can have on site, but if you don't have them on site, that's okay. But you need to have referral, affiliation, or contract for these off-site non-core comprehensive services. So this is diagnoses, therapeutic services, any crisis emergency services, consultative services, and case management. So like I was saying, the documentation needed for those three core services, you need to have, a site brochure, any site policy outlining the services, any documents that show these are the available core behavioral health services on site. That is what you're going to upload. For the non-core, that might be out of network or off-site. This is, again, those affiliation agreements, memorandums of understanding agreement, contracts, letter of referral, or letters of support, that this is the organization we go to because this service is not, on site here. So definitely uploading these documents as needed. Again, you're going to fill this all out, this checklist. This section 1 is just checking off, yep, we provide the 3 core behavioral health elements. Section 2, these are the non-core. So check, are these on site or are they off site? Any offsite, this is where you're filling out the information for that organization that provides, that you're referred to or, might collaborate with. So definitely filling out this information, but don't forget to upload, again, any of those memorandums of understanding, letters of support, because you still need that document too, saying there is some agreement with that organization that offers that non-core behavioral health services. So that's where you will list them there. And then just the certification of compliance with the behavioral health clinical practice requirements, basically saying, do you have any full-time or is it half-time participants on site for the behavioral health providers there. And then section 5 is just certifying that everything is accurate and you sign. So then there's also the substance use opt-in documents. So if your organization, your site does provide substance use services, then you would want to opt into this. If you don't, then you don't have to worry about this. But if there are any sites here who are going to utilize substance use services, the first document you will need to submit is proving that you are offering these substance use disorder services. So again, site policy, site brochure, any documents that include that you offer substance use disorder services. Then you'll also have a letter too. This is medications for opioid use disorder services letter. And this has to come from your CEO or your medical director. And within it has to state that the site offers medications for opioid use disorder on site, the days and hours when the site offers this medication, and the size of the medications for the opioid use disorder during that 6-month reporting period again. And again, here's a nice example of how that letter can look too. So again, just needs to be 1-page letter, can provide what this example shows too within it. And that is basically all of what is included in the application. So when you're ready to submit, highly check, of course, reviewing everything, that you have all the necessary documents uploaded, policies, everything's up to date. You're going to review the NHSC site agreement, confirm your site's compliance with NHSC requirements, and electronically sign the application and submit. So once submitted, it's within usually 21 days, the Michigan Primary Care Office will be the first ones to review it. They'll determine if you're eligible for NHSC and meet all the requirements and add any comments. They will then pass it on to HRSA, who's going to review and evaluate it along with the primary care office's comments, and they will make the final decision. So the application process can take longer than the 6 to 8 weeks. That's usually the average, can be sooner. If you're highly, have everything prepared, and when that cycle opens, you basically just have to upload and submit, then it might be processed sooner than those 6 to 8 weeks. But it can obviously take time. So definitely it's going to take them time to review all those applications because you also have to think about it. There is one person for the primary care office, usually one person for HRSA that's dedicated to Michigan. And here we're just talking about rural, more focused sites, but obviously to those urban locations. So there's a lot of places throughout Michigan that usually try to submit a new site application every year. So it's going to take time. So please don't harass any of them. But the final decision on a new site application will be communicated to those site point of contacts through the portal. And if you want any more information too, I have the site here, Becoming an NHSC Site, where I got all this information as well. So please look at it, especially as it gets closer to that May, June timeframe. And highly recommend for signing up for HRSA.gov, on their NHSC, their emails, because they'll update you way in advance via email when a new cycle is about to open. So highly recommend for both employers and for employees as well. In those important contacts I was talking about, again, the Michigan Primary Care Office, Miguelina, she's a wonder with the HPSA. She does awesome work. And if you do have any questions about the NHSC site application, reach out to Megan because she's going to help a lot with the site application process. Of course, can ask me, but she's the one who's going to handle all those applications. So really reach out to her as well. And then any information about finding HPSAs, looking at your HPSA type or that, there is the data.hrsa.gov/shortage area tools. It's great for both geographic and facility type as well. And as I've said, expected opening of cycle is early June of 2024. Once it gets closer, can definitely send that information out. Sometimes it can be late May, but that's expected as of now is around early June. And I'll stop right here for now. Amy, are there any questions in the chat before we move on to Michigan State Loan Repayment Program?
Yeah, there are a few. I see that Angie asked if you know if CCBHCs or certified community behavioral health clinics will be considered as auto-approved sites in the future.
I'm not sure in the future. Again, it could be one of those updates, that they do each year as it gets closer to the cycle. That's probably, a good question for HRSA. I don't know if the primary care office would know. I have not heard anything, but as of now, no.
Okay. And then Shannon mentioned that she saw that SUD counselors were on the list of individuals who might be eligible to receive repayment from that program, although you just said that bachelor's levels individuals aren't included. So she's wondering, what about bachelor level limited BSWs who have MCBAP certified alcohol drug counselor certification?
Yeah, so unfortunately, as of now, again, it's just HRSA's requirement that those counselors have to be master's or PhD or doctoral level. Again, I think the reasoning, I don't know for sure. This is just, again, my opinion. I think it's just a lot because of that graduate degree program is a little more costly than bachelor's, even though bachelor's, of course, too, you're going 4 years, is expensive as well. But I do think that sometimes their view of it, why they have targeted, that graduate level more. So yeah, unfortunately for substance use counselors have to be master's or doctoral level.
All right. And then I think just one last question. Nicole says, just to clarify, can we start applying in June of 2024?
For the, I'm assuming for the site application, is that, or the employee? I can do both, I guess.
Okay.
So for the employer to be a new site, it's expected in May, or late May or early June. So that will be if you've never been a site before, an NHSC site, or maybe you've let it pass that you're not an NHSC site anymore. Either way, new sites open again once we get that date a little closer to late May, early June. For the employee side, for the NHSC application, so maybe your organization is already an NHSC site, that usually is in February, more late February, early March. I haven't seen anything yet about when that's supposed to open either. I do get HRSA emails, so I haven't seen anything yet on when for the employee when their application is supposed to open. So hopefully pretty soon they'll release, but usually that is later in May, March timeframe.
Okay. And then I don't know if you have time for one more, but I do see that Kate had her hand raised.
Yeah.
So I don't know if Kate, you want to unmute?
Yes. Can you hear me okay?
Yes.
Oh, so Paige, I actually have two questions. So if a nonprofit has several clinics and let's say one is in a health care shortage area and the other isn't, can that nonprofit apply for that particular site and then any employees working there would be eligible for loan repayment is my first question. The second one is, what are the maximum loan repayment benefits then per individual?
Yeah, so for the first question, so yep, we've seen many organizations have different, sites that they would like NHSC approved. They do have to do, a separate application for each, but that HPSA one is a big requirement. So if one, that one that does have the eligible HPSA, they can definitely apply. If they don't have any HPSA at all, I'm talking no score at all, because I know the question has come up too of, well, what if I have a lower HPSA score for my site? Still apply. I've seen like 2 3s be NHSC sites and they have a HPSA score of like less than 5. But if you don't have a HPSA score at all, meaning not even 0, usually that means there's a lot of providers in that area or, maybe lower poverty rates. Again, the HRSA or the primary care office can help you more with that HPSA, figuring out the designation that way. But if there's, an organization has 2 sites and the one doesn't have a HPSA score at all, unfortunately would not be able to apply for the NHSC site. They can apply for that site that does have a HPSA, an active HPSA, but for the other one, if the HPSA is withdrawn or again, don't have a HPSA at all, unfortunately that site wouldn't be eligible. For the second question, I can go back and later into the slides too, but earlier I had a screenshot of the breakdown of for the employees of how much they can receive from the NHSC.
Oh, okay.
Yeah, there are 3
Yeah.
programs, so their financials look a little different. The rural community one, they can receive up to 100,000 for 2 years of service. They can continue on with NHSC. I don't think there is a limit. I think at a certain point, though, it does go down the amount. But for that rural community one for 2 years as a full-time provider, they can receive 100,000 in loan repayment.
Wow.
Yeah,
Mhm.
there is a part-time option. That one is usually half of what the full-time is. So I'm assuming for that one as well, it'd be around like 50,000 if you did the rural community. So yeah, so that's nice also too for those who might be part-time as well. There are at least just for the NHSC MSLRP, you need to be full-time, but for the NHSC employees, there's a part-time option as well.
Oh, thanks, Paige.
Yeah. Well, I'm going to move on to the Michigan State Loan Repayment Program, and then we'll, at the end, have more time for Q&A, hopefully. So this is through the Michigan Department of Health and Human Services, this loan repayment program. It's going to be similar to the NHSC in many ways, but there are some differences. I think not as much data heavy that you have to submit for your site application here. But of course, again, this HPSA comes up. So that's why we briefly talked about HPSAs at the beginning, because it's pretty prevalent requirement here for both the loan repayment programs. We do have to submit a sliding fee schedule and a policy based again on those federal poverty guidelines. You have to be a nonprofit site, and then the certification of practice site compliance. This is just the practice site application here itself. What's a little unique about MSLRP versus the NHSC, all the funding for participants comes from the federal government. So it really doesn't come out of your pocket at all when it comes from the NHSC. But if you are an MSLRP participant, a site participant, you are going to have to contribute 20% of the provider's agreement amounts. So usually it's about the same of like about 50,000 a year. You know, the NHSC, the OG or original one was 50,000 for the 2 years of service. So that's usually what it is with the MSLRP as well, but there is more of a calculation with this, since 40% of the funding is coming from the state government, 40% from the federal, and 20% is coming from your employer here with the MSLRP. So it is a little unique in that. So that's why I always, pros and cons of each, of course, loan repayment programs, but both are very great programs that I especially in other rural areas too. I know a lot of our hospitals participate in MSLRP too. So even with that provider agreement amount, it is a very great loan repayment program to be a part of. If there are any for-profit employers on the call too, there is contribution for up to 50%. So if you're placing providers in a nonprofit practice site, but you're a for-profit employer, you have to contribute up to 50%. So I just like to give that as well. I don't know if we have any on the call today, and also you cannot use any federal funds on loan repayment when you are making your employer contribution yourself. And these are the eligible practice sites and professions. I won't go over all of them, but again, more of those clinic types. But you see too, again, with the behavioral health provider side, have to be that master's, PhD, doctoral level as well. So discounted sliding fee, again, comes up, fee policy. So actually MSLRP does require that your discounted sliding fee schedule and discount sliding fee policy has to be compliant with the NHSC standards. So even if, again, you're not applying for the NHSC, here it comes again with kind of the requirements. So again, I've linked this site reference guide and the pages where it can be found of examples of that sliding fee schedule and the policy, again, including that screenshot you saw earlier. But definitely include that, making sure it's NHSC compliant. So kind of without the data tables here, you're providing a lot of similar things, especially that sliding fee discount policy is just a big priority to HRSA, to the state, because making sure you are providing, cost to your patients, a lower cost, of care, especially for those patients who, again, under that poverty level. So that's why it's a big focus in both these loan repayment programs. So the certification of practice compliance. So this is basically just reviewing this practice site application that the employee will attach to their application package. So this is a little unique for the NHSC site application, and it's reserved, I should say, the NHSC is reserved site application, and then there's the employee application side. So with the NHSC, you just had the site application side that the employer worked on, and the employee, once the site is approved, of course, and is an NHSC site, can apply to be an NHSC participant. With MSLRP, it's kind of a partnership with both the employer and employee, but the employee will be the one to submit all of the necessary application information. But the employer must fill out the practice site application part of the application as a whole. So with the practice site application, you are going to just answer questions about, requirements of hours for employment week, hours of direct primary care clinical service, and of course, limits on compressed provider schedules. And everything can be found on the MSLRP website. The application, the most current one for 2024, is found under application periods, forms, and process. So I did not screenshot the practice site application. You can go look at it. It's 8 pages. And again, half of it is mostly a lot of space for multiple practice sites that you can put on there. So definitely not a very long application at all. Of course, we're going to attach the necessary documents, but really it's you filling out, again, this application, not the provider. And it'll ask again about that agency information, provider information, and practice site or sites information. Along with that application, you're going to attach your proof of a tax exempt status, so your 501c3, that discounted sliding fee schedule and policy, and posted signage, again, of that discount sliding fee. So loan and payment agreements, when filling out the practice part, the practice site of the practice site application, those loan payment agreements can only be awarded for practice sites included in the original application or requested after that October 1st. So employees will be notified if they have received MSLRP loan repayment on October 1st. So if you're looking at this year, October 1st of 2024. When you are filling out that practice site in the application and putting down, if it's just one practice site, just put one. But if anywhere between it opens in February, from February to October 1st, your employee will be working on multiple sites, or maybe you're moving a site, maybe your site is moving, June 1st, let's say, or that. Definitely put that address and that location of that practice site, even if they're not working there yet, because you are not going to be able to request it in the middle of the primary care office trying to get work through applications. They're going to tell you to wait, or it could be denied too, because you're trying to alter the application after it's past due. So definitely, if the employee is going to be working at somewhere, if you don't list that practice site on the application, you're going to have to wait until after October 1st to put it. So, or if new application sites do come on, again, have to wait till that October 1st to request approval of additional practice sites. Of course, making sure they're all eligible practice sites too, as well. And due to federal reporting requirements, employers, you have to use a 9-digit zip code for all the practice site addresses. So just common mistakes is obviously not filling out a lot of things, missing one or more sections are incomplete, making sure you have the most up-to-date version of the form. Again, going to the MSLRP website now, their 2024 application is all up, and forgetting to include the practice site application form in the package overall. Something also too that I've gotten questions about, well, what if an individual works at a non-eligible site, once a week? They can work in non-eligible sites, but 40 hours has to be spent at an eligible site of practice. They can work outside of those 40 hours, if they work more than 40 hours a week, can be at a non-eligible practice site. But there is no part-time option here like there was with the NHSC. So 40 hours per week has to be spent at an eligible site of employment. And again, as we talked about, not including all the practice sites on the application, and eligible practice site, you forget to attach any necessary documents or forgetting the 9-digit zip code. So similar to NHSC, this is one time to apply a year for the MSLRP. You're agreeing to a sponsor to employ them providers throughout their service obligation. If you're uncertain about employee provider, sponsoring any providers, you should not try to sponsor them. again, that's with your means. If you're not sure about an individual, that you might not seeing continuing on at your organization, we just say use with caution to then participate in MSLRP, because if you do terminate an MSLRP participant without good cause, it's a breach of their agreement. So then you cannot sponsor new individuals for the next application period. So just FYI on that. And then employees will be notified by October 1st of 2024, again, if they receive into the MSLRP program. And any more information about the state loan repayment program can be found there. All of the application materials are up to date. They just released it before the new year here. So it is good to go. And again, important contacts, again, with Miguelino with the HIPSAs. Brittany will be your point of contact for the MSLRPs. She's really great and it was very knowledgeable to, again, reach out to her about the site application or the application cycle as a whole. And then again, with the finding HIPSAs, those similar are the same, the links there. And the application cycle will open here in a few weeks. So February 1st, it's opened, and it is open till April 30th, which is great because last year it was, I think, only the month of March. So it gives you a little bit of time to, again, update your policies, making sure your employee, is the one handling all this, but making sure they have all the necessary documents from you, that practice site application information as well. And just as I wrap up, I know some people, you always ask, well, why should I participate in a loan repayment program, or why should my organization? And I, of course, wish I had a little more data than what I have on this slide. That's kind of what I hope for the next few years, that individuals who do participate, organizations that do participate in loan repayment program can kind of track how their workforce, how loan repayment programs have helped their workforce personally for their organization. And maybe some people, some organizations do, but it would be nice to kind of track that as well too, because we can see the number of participants that participate in rural versus non-rural, but it's kind of hard to see how is that, in a 10-year, if we're looking at 10-year span, help that organization with their workforce. But I would say benefits of participating in loan repayment program, this is all coming from the Michigan Health Council. They do great work and research too, just beyond workforce. But here they've really looked at, this really helps equally distribute healthcare providers in rural areas, especially between, we're looking at here on the chart, fiscal year 2020 to fiscal year 2022. An average of 72% of participants in MSLRP worked at rural practice sites. So the blue there is those number of participants in rural versus in the orange participants in non-rural. So I think it's really helpful, especially to get to our rural areas, get those providers and even looking at the NHSC, about 50% usually participants in Michigan work in rural. So I think the NHSC, HRSA does try to do a great job. Of course, it depends on the participants that do apply and application wise, but they do try to even out of not all of the participants or applicants go into urban areas. They are looking at rural areas as well too, to again, equally distribute those providers to our rural areas. But beyond that, I think it's a great recruitment and retention tool. It shouldn't be your only tool, but I do think it is a good one, even though we are the recruit behavioral health providers team here with the recruitment focus. It is also a good retention tool. I know within this post to Michigan Health Council, I think they said close to about 80% of individuals that participate in either one of the loan repayment programs, either they stay in that organization after their contract is ended or go to work in another HIPSA. So I think that's really speaks for itself too. Obviously, we'd like to retain them within our organization as long as we can, especially if they are a really great employee. But to see them help wanting to go to an organization maybe similar or to a county similar of HIPSA score too is very beneficial for our rural areas. And then I think a lot of the providers see increased access to primary care and behavioral health services when they come in, especially if they weren't there before they entered that organization or came into that county. They realize, hey, I'm really impacting my community here. They see they're making a difference. So I think that's what really gets them to stay as well too. So I think, loan repayment programs, I see a lot of funding for both opportunities as well too, especially if you're looking at the NHSC or MSLRP from either either the employer or employee side. There is a lot of funding right now for both. So I think it's going to be a great, either one is a great program to be a part of for the years to come. But that is everything I have to share today. I'll stick around I know there's probably a few more questions, but if anyone wants any more contact information, please feel free to reach out to me. I'd say email is the best way to get a hold of me, just because I'm not my work phone. I'm not always mostly remote, so email would be the best way to get a hold of me. But definitely to reaching out to those contacts that I mentioned throughout the slides as well, because they are the masters at what they're doing for both MCRH and for the NHSC programs. But I will stick around for any questions. Thank you so much too for attending today.
Well, thank you, Paige. Thank you. Shared a lot of really valuable information. And so I think there are a few questions in the chat, and I'll start with Katrina's because she had asked earlier as well. If you could please just clarify if you can be a limited licensed master's level clinician, such as a limited licensed professional counselor or a limited licensed MSW, or do you have to be fully licensed?
Yes, and I should have included a slide on that. So I'm sorry, I apologize for that, because that question has come up many of times too. So for NHSC, you cannot be limited licensing. They want you to be fully licensed to apply. For MCRH, you can be limited license. So you can apply for MCRH if you are limited license.
All right, thank you. And then Cassie asked, does the MCRH require a certain amount of client direct service hours?
So I think I would have to go in and look. I know it has to be 40 hours total, but if they have to be all client, that is a good question. I can go in and look because I am not sure either. I think they would want a good majority to be, but yeah, what the breakdown is, I'm not 100% sure, but I can look for that information.
Okay. And Jennifer had asked, what if someone was approved for another employer and they change jobs to work for her organization? Do they have to reapply to participate all over again?
So I guess with the NHSC, I'll first start with NHSC. So if the individual is an NHSC participant and they move from another organization that was an NHSC site and your site was an NHSC site, they're fine. They have to do some paperwork, obviously, themselves through the BHW portal. But if you're an active NHSC site yourself, they will then, again, just have to do that paperwork on their side. For the MCRH, it is a little bit more tricky. Usually they don't. Usually that's why I kind of mentioned a few slides back that if you're, of course, you might not know as the employer or that if your employee is going to stick around or not. Sometimes they'll say, hey, I'm looking at another area or that. But for, I think the most part, I would assume that you don't know if your employee is going to go to another organization or what employees you're going to bring in. So for employee, usually the MCRH, they don't like you to move from another organization to that. They usually want to stick into your to your employees. So usually they do have to reapply, I believe, for MCRH. So even if someone left too and went to a different organization that was an MCRH site, because they don't know your provider information, the MCRH team doesn't, meaning so it's recommended not to, especially if it's completely different organization. I know there might be some systems that, just maybe move downstate or that if they're within the system, that's different. But if it's completely different organization, usually I don't think they let the individual, then their loan repayment program would stop. So yeah, with MCRH, it's a little bit trickier usually they do not, usually the employee's loan repayment would stop then, and yes, would have to reapply.
Okay, and then as a follow-up question, Jennifer had asked, do you know if that's true for My Kids Now as well?
That's a good question with the My Kids Now, and probably to just mentioning why I didn't mention My Kids Now, that's also a great loan repayment program. That one too is more school focused. Obviously it's a great program. We just ourselves, I think, has been unclear to how how long that program will last too. So that's why I didn't mention it in this. It's obviously still pretty new. I think it's been second year in 2023, but that is also a great program, especially if you have employees, offer school services, children under 18 services to definitely apply to as well. I would have to look more into that with my kids specifics too to see, and I can send on information to you, Amy, as well for those questions too regarding MSLRP and my kids.
Okay, great. Thank you.